Today, we're going to get into a topic that so many new mothers face, but so few of us actually talk about out loud: pain after birth. It's a really personal subject, and just understanding what's going on is a huge first step toward feeling like yourself again. And to help us do that, we're going to lean on the incredible expertise of the Women's Health Clinic to really shed some light on this whole experience.
This is it. This is the question that so many women are typing into search engines late at night, often feeling totally alone. If you've ever wondered this, I just want you to hear me say your feelings are 100% valid. It can be so confusing and honestly pretty heartbreaking when your body doesn't bounce back the way you thought it would, especially when it comes to intimacy.
And just look at this number, 62%. That's how common this is. We're talking about a majority of women who report painful intercourse, or what doctors call Dyspareunia, a full 3 months after giving birth. For a lot of women, it can go on even longer. So the biggest takeaway here is that you are not the exception. This is a very, very shared experience.
So, to really understand the whys and the how to fix it, we're turning to a true expert in this field. Let's meet Dr. Farzana Khan. She's a leading voice from the Women's Health Clinic and has really dedicated her entire career to these exact issues. Her work is the foundation for everything we're about to cover. You can see right here, Dr. Khan brings more than 2 decades of experience to the table. After getting her medical degree way back in 2003, she went on to specialize, getting a specific diploma in sexual and reproductive health. And today, she's not just treating her own patients, she's actually training other doctors. That really makes her an authority on all things vaginal health and rejuvenation.
Okay, so what is actually going on in your body to cause this pain? Well, based on Dr. Khan's work and research from her clinic, it usually boils down to one of 3 core causes. A lot of the time it's a mix, but figuring out the main driver is absolutely the key. So let's break them down. Think of this chart as like a little symptom matcher. It's so helpful, because the pain isn't just one thing, right? If you're feeling a really sharp, localized sting right at the entrance, that points to a structural issue, probably scar tissue. If it's more of a deep ache, almost like you're hitting a wall, that's likely muscular. And if it's more of a general burning or that awful sandpaper feeling, that's almost always hormonal. Let's dive into each one.
First up, scar tissue. So if you had a tear or an episiotomy during birth, your body heals by creating a scar. The best way to think about it is like a patch on your favorite pair of jeans. It's just tougher and it doesn't have the same stretch as the original fabric. Those less elastic fibers can create really tight spots that pull or sting painfully.
Okay, next up is muscle tension. This one is all about your body's protective instincts just kicking into overdrive. After the experience of childbirth, your brain can start to anticipate pain. And what does it do? It sends a signal to your pelvic floor muscles to tense up, to basically guard the area. This isn't something you're doing consciously. It's an involuntary fear-pain cycle that creates a very real muscular barrier.
And finally, we have hormones. If you're breastfeeding, your body is churning out a ton of prolactin, which is awesome for making milk, but that prolactin also suppresses estrogen. And estrogen is the superstar hormone for keeping your vaginal tissues thick, stretchy, and lubricated. So when estrogen levels are low, those tissues can get thin and dry, which leads to friction and that burning sensation. The good news, this is almost always temporary.
All right, now that we get the real physical causes, it is time to bust some of the most harmful myths out there. Because honestly, these misconceptions create so much unnecessary shame and anxiety for new moms. I feel like almost every new mom has heard this one. There's this pervasive idea that 6 weeks is some kind of magic finish line. And if you're not back to normal and ready for sex by then, well, something must be wrong with you.
But let's get real about this. The 6-week checkup is there for a doctor to make sure your uterus is shrinking back and your stitches are healing correctly. That's it. It is not and was never meant to be a green light for sexual comfort. Everybody's healing journey is completely different, and there is absolutely no normal timeline.
And here are 2 other big ones we have to shut down. First, this myth that pain is from being loose. It's not true. The reality is that the pain is almost always caused by tightness, from scars or tense muscles. And the other one? Just do more Kegels. You have to be so careful here. If your muscles are already super tight and guarding, doing more Kegels is like clenching a fist that's already cramping. It can actually make everything worse.
Okay, so we've identified the causes, we've debunked the myths. Now for the most important part. What can you actually do about it? Let's talk about the real, evidence-based solutions that can help you heal and feel good again.
You can actually start with some of these gentle strategies right at home. First, and this is non-negotiable, lubricant is your best friend. Use a good one and use a lot of it. Second, once you get the okay from your doctor, gentle daily scar massage can do wonders for softening up that tissue. And third, deep belly breathing, diaphragmatic breathing, is an amazing tool to help you consciously relax those muscles that have been tensing up on their own.
Now, if you try those things and it's still not enough, please hear me when I say it is time to seek professional help. And there are so many amazing options. Pelvic health physiotherapy is really the gold standard. For that hormonal dryness, topical estrogen is totally safe, even if you're breastfeeding. And for more complex cases, there are things like scar revision and even psychosexual therapy to help with the emotional side of things.
And I really want to end this section with this incredibly powerful message straight from Dr. Farzana Khan. This is not something you just have to live with. The most important thing you can take away today is that with the right diagnosis and the right support, recovery isn't just possible, it's what's expected for the vast majority of women. There is so much hope.
So I'll just leave you with this question to think about. What would it look like if we totally shifted the conversation around postpartum care? If we moved away from just a 6-week medical sign-off and toward a system that actually supported a new mother's complete well-being, physical, emotional, and sexual? It's a really important change, and it's one we all need to start asking for.